one that everyone is aware of is the anterior cruciate, or ACL. Those occur primarily in skiers. They're much less common in snowboarders unless they're jumping, such as in the terrain parks. The anterior cruciate prevents anterior translation of the tibia and the femur. They occur in a variety of different ways in skiers. They can either occur in association with a medial collateral ligament injury, where the leg is rotated to the outside. They can also occur in skiers when they sit back on their skis and catch the back edge of the ski and twist the knee with the knee flexion. They can be quite devastating for long-term function, and typically in our patient population that's skiing already, they want to be active and will usually require some type of surgical intervention to reconstruct the anterior cruciate. The next most common injury that most people think of is the medial collateral ligament. The incidence is actually a little bit higher than isolated anterior cruciate injuries. Medial collateral ligaments that aren't severe will usually be treated non-operatively, and most people recover quite nicely with just some type of splinting for a while. Very rarely the posterior cruciate ligament is injured, and it's typically injured in skiing, either from a direct collision with something like a tree, or in a severe flexion injury where the medial collateral ligament and the posterior cruciate ligament are injured together. They're quite unusual, but when they do occur, they're quite dramatic. We see several a year of the posterior cruciate ligament and medial collateral ligament injuries. They, again, can typically be treated non-operatively.
Let's go back. I just want to go back to a point you made about the ACL tears, that they commonly require a reconstruction. Can you tell us a little bit about what the timing of that surgery should be after somebody tears their ACL in the slopes?
I tell my patients that the most important thing is not to confuse the acute phase with the chronic instability. We try and get our patients over their acute phase. In the acute phase, they'll have pain, they'll have swelling, they'll feel unstable with their knee. That can last anywhere from a couple of days to up to 6 weeks. So we frequently will send our patients to physical therapy during that time to have them work on range of motion, to work on strength so that they don't develop disuse atrophy. We want them to feel comfortable after the injury. They'll frequently have some type of bone bruising, typically on the tibia that causes pain. So we want that all to settle down. Once that's settled down, if they're going to be very active long-term, participating in pivoting sports or activities that require sudden stopping and starting, then we'll frequently recommend that they have that reconstructed at a time that makes sense for them. Some people, particularly in our patient population, will want to get this done as soon as possible. And for skiers, the advantage of doing it soon is that they can rehabilitate through the summer and be ready for the ski season the following year. Others, it just doesn't make sense, whether they're students and going to school or business or whatever, and will delay for a period of time. But during that time, it's very important that they don't do further damage to them. Tell them to avoid any type of pivoting sports.
And somebody who decides not to have surgery, they essentially have an ACL deficient knee. Are they still able to ski?
Skiing's not the issue. You can ski very well. There are many professional skiers who have skied without an anterior cruciate ligament. As long as you keep your knees bent and do everything properly, you won't have any problems. But as soon as you get into a situation where you're unstable or off kilter somehow, then the knee is vulnerable to further injury. And they can have episodes of what we call subluxation, where the tibia shifts on the femur. And then they potentially do further damage to the knee. And so it's not so much that they can't ski, it's that they're at much higher risk for recurrent injury. So we don't recommend it, but there are people who obviously who do go out and do it.